Before you continue watching, make sure you click the link below to check out the part 1 and part 2 for the study guide. Subscribe to the channel if you want to see more videos about healthcare.
Big disclaimer, I am not a certified nursing assistant instructor. I simply just use this Prometric study guide to pass my certified nursing assistant written exam. And most of the questions were on the test, just reworded. The link is in the description, but the pictures are blurry, so I'm doing this video. By the way, if you haven't watched test 2, the link is right above, also in the description. With that being said, I want to advise you to study my Prometric playlist at your leisure and use it as a comprehensive resource to pass your written exam. With that being said, let's begin the video.
Question 1. Before helping a resident to stand who has been lying in bed, the nurse aide needs to: is it A, find out what the resident plans to do for the day? B, make sure a walker is available for support in case it is needed? C, ask if the resident has taken any medication recently? D, allow time for the resident to adjust the setting at the edge of the bed. So out of all of these questions, which one would it be? The answer is D. Allow time for the resident to adjust the setting at the edge of the bed. The reason being is because when a resident have a change in position, especially when moving from lying to sitting or position from a seated to a standing position, there's a risk that they will feel a bit dizzy from drop of blood pressure. So it's very, very important to give the resident an opportunity to adjust to the change in position. When a person is positioned sitting on the edge of the bed with legs hanging over the side, this is called dangling. Letting the resident dangle for a few minutes before standing helps blood flow to adjust and help reduce the risk of falls. This same shift in blood pressure can occur when the resident stands, so it's important to ask how the resident feels when standing. If the resident feels dizzy, it is safe to help the resident to sit back down. So before you make a transfer from standing to lying to bed, whatever type of transfer you are going, rather it be with the wheelchair, two-stand lift, Hoyer lift, or just with your body mechanic, make sure you adjust the bed, give it some time, and let the resident sit at the edge of the bed so they can feel themselves in the moment, and ask them if they're okay, if they're feeling good to make the transformation. Because sometimes residents, when you're in the field, they're not ready to move when you're ready to move. So it's best to always remember, allow time for the resident, because they come first, to adjust the setting of the edge of the bed. So the answer would be D for that reason. Question 2. When helping a resident transfer from a bed, a chair, which of the following best demonstrate appropriate safety techniques? Is it A, place a gait belt around the resident's waist? B, position the chair as close to the bed as possible? C, signal the resident to stand by saying 1, 2, 3, stand? D, follow the transfer technique as described in the care plan? The answer is D, follow the transfer technique as described in the care plan. And let me tell you why. Use of gait belt signals a resident to stand. So that's why A will be canceled out. B is canceled out because positioning a chair correctly can be important to a safe transfer. Yes, it can. But remember the question. It says best. Which of the following best demonstrates appropriate safety technique? So that means that the transfer technique described in the care plan has been determined based on the resident ability or your patient's ability. We cannot really say a gate bell, positioning them with the chair, signal the resident to stand on 1, 2, 3 will be best because we do not know the patient care plan. When you're working in the field, these questions, you have to really think of them as if you was working in the field. The CNA written exam is not trying to trick you. They're not. They just want to know, do you have the basic knowledge to be in the field and perform things correctly? So, it's asking what is best. Out of everything, the best option is to see what is in the care plan. Because the care plan gives what type of devices they use in order to transfer from bed to standing, from the floor to the ground. Every resident is different. Question 3. When a resident wears, to correct you guys, that is a human error. I said wore. I'm not perfect, but I meant to say wears. So let me reread the question for you. When a resident wears a restraint, the nurse aide must make sure A. Resident is wearing an incontinent brief. B. Resident is checked once every 2 hours. C. Restraint is applied following the manufacturer's instruction. Or D. Restraint is applied tightly and placed under the resident's clothing. And the answer is C. And let me tell you why. Firstly, the use of restraints in a nursing facility has been greatly reduced by a lot. So you will barely see a resident having to use a restraint. Many facilities are restraint free. However, when a resident is required, it must be applied following the manufacturer's instruction. If a nurse aide is unsure of the correct application, the nurse aide should tell the nurse. Residents who are restrained should be checked frequently, so you might want to say it's B, but you should follow the instruction. It's important that the nurse aide, you as the CNA, understand that the resident who wears the restraint can still fall and are still at risk for injuries. That's the reason you always have to check your residents every 2 hours, regardless of if they're in a restraint. So residents who are restrained are often positioned where staff can watch them closely. Restraints must be released at least once every 2 hours. During this time, residents should be given the opportunity to move and adjust positions. So you can position them, let them use the bathroom and do all of that. But it is very important to follow the instructions of the restraint because every instruction for how to apply the restraint is different. So just follow the manufacturer's instructions. Question 4. A resident is choking. The first, mind you, that's in bold, the first response by the nurse aide, you as the CNA, should be A. Find the charge nurse. B. Get the suction machine. C. Call emergency service, which will be 911.
or D, begin abdominal thrusts? The answer would be D, begin abdominal thrust. And here's why. When a person is choking, time is of the essence. It's very, very vital. It's very, very important. Beginning abdominal thrust immediately can mean the difference between life and death. So you have the power in their life right then and there when your patient, your resident, is choking. These thrusts can help by forcing air out of the lungs and creating an artificial cough, so it allows them to have air passing through their lungs. While, emergency assistance should be called, of course, but abdominal thrust should be started immediately. If your patient becomes unresponsive, you as the CNA trained in CPR and abdominal thrusting can begin life-saving changes or techniques. So the first response you should do as a CNA is to begin abdominal thrust if you see your patient choking. And this can occur when you're like feeding a patient and say they choke on the water, they choke on the food they're eating. What will you do first? Are you gonna call the nurse? Are you gonna call 911? No, the first thing you should do is put their lives in your hands and give them abdominal thrust. Then if that fails, you call the nurse. The nurse will call 911, and then 911 will get suction machines. Everything falls in place. But that is the first thing you should consider. Question 5. Which of the following is considered a normal age-related change seen in elderly residents or elderly patients? Is it A, increase in appetite, B, decrease in constipation, C, decrease in taste sensation and smell, or D, increase in amount of confusion experienced daily? Now, you got to think of the old. What is very common no matter what type of disease the elder have, what type of family history, health history they have? What is something that everybody, say 65 and older, have in common? It's C, decrease in taste sensation and smell. And this is why. As you age, sensory ability decreases. One of the changes seen in elderly people is decrease in the ability to taste and smell. For this reason, many elderly patients may have nutritional issues. Consider that the ability to taste and smell food stimulates the appetite and helps make eating enjoyable. When a person is less able to smell and taste their food, this can become a source of frustration and cause them to lose interest in eating. You as the CNA should encourage your patient or resident during mealtime. Even when the patient or resident has minimal interest in eating, and this is very, very common when you work in the field, that a lot of your patients would not want to eat so much. And the reason being is because they are decreasing the sensation of taste and smell. So A, appetite, I hope I'm pronouncing it correct. Appetite, yes, appetite could be it, but they commonly have a decrease into taste and smell. Question 6. When weighing a resident, it is important to make sure is it A, resident's last measured weight is available, B, scale measured both pounds and kilograms, C, resident is wearing lightweight clothing such as pajamas, or D, scale is balanced or calibrated before helping the resident onto the scale. Now, think about it. When you're weighing your resident, out of all of these, which one is the most important to weigh a person. Think about yourself when you go to the doctor's office to get weighed. The answer is D. Scale is balanced or calibrated before helping the resident onto the scale. Now, a lot of these may seem pretty tricky and similar, but like I said, if you go to the doctor's office, the first thing the doctor or say the medical assistant do is calibrate the scale to make sure that it is all set for you to be weighed. You as the CNA need to ensure an accurate measurement. So the CNA has to make sure the scale is calibrated or balanced before the weight is measured. Question 7. A nurse aide is assigned to a table in the dining room during the resident's lunch. One of the residents who is seated, and this is a human error, I meant to say it begins, not at the beginning. So one of the residents who is seating begins to have a seizure. The nurse aide has been called. The next action by the nurse aide should be, is it A, guide the resident from the chair to the floor, B, remove the other residents away from the table, C, try to open the resident's mouth to check for food, or D, keep the resident in the chair by holding around the resident's waist. Also, another human error. I misspelled guide. So, you as the CNA, say you are in the dining room, it's time to feed the residents. One of your assignments, your patient start having a seizure. What is the next action you should do out of all of these options? And the answer is D. Reason why is because when your patient is having a seizure, you as the CNA primary responsibility is for safety of the resident. So a patient who is seated in the chair at the table is very likely to fall out of the chair during a seizure and be injured even more during the seizure. Helping guide the resident onto the chair is safer than allowing the resident to fall. The seizure actively cannot be stopped. You cannot control that, but placing your patient on the floor will reduce the possibility of injury. So, you as the CNA should also loosen any restrictive clothing. If the clothes is too tight, protect the resident's head just in case it's being knocked from the floor, and push any type of furniture out of the way. If the resident begins to vomit or is drooling, turn the resident onto the side. It's important to prevent aspiration or for them to be choking on their spit, saliva, vomit, etc. So the answer would be D. Keep the resident in the chair by holding around the resident's waist. And while all of these options is very good for you to pick, it could be very tricky, but the question is not supposed to trick you. It's asking what is the next action you as the CNA would do, and the next step if someone's having a seizure is to make sure that they're in the chair and they're not falling. Then when you keep them held by the waist, the next step could be laying them to the ground. Then the next step could be moving all the furniture out the way. But the first step out of that, the next step once they have a seizure, is just to make sure they are safe and do not get further more injured. So that's the reason for it to be D. Question 8. Which of the following is generally experienced by a resident with low blood sugar? Is it A, fever, B, weakness, C, sour breath, or D, frequent urination, or just, using the bathroom a lot. So out of all of these, which one is more common? Which one is like a general experience for someone who has low blood sugar? Or say their blood sugar levels are just low in general. So the answer is B, weakness. And the reason being is because the condition of low blood sugar, which also is known as hypoglycemia, your patient with diabetes are at risk of experience low blood sugar too. So you can have diabetes and you have experienced low blood sugar, or you can't have diabetes and just say like you haven't eaten in a whole day and still experience low blood sugar or hypoglycemia. But the symptoms of hypoglycemia are weakness, fatigue, confusion, sweating, trembling. Like if you ever experience not eating, which I don't recommend, you will feel so weak, tired, and trembling, as if like your body is going through this state of trying to keep itself up. So these symptoms indicate that you're going through low blood sugar, or your resident is having low blood sugar. So if your resident is going through this person would need to receive a source of sugar and possible medical attention. When the nurse aide or you as the CNA observe possible signs of hypoglycemia, the CNA should, or you as the CNA should, notify the nurse ASAP, immediately. If your resident can follow direction, the resident might be given juice to drink or other sources of quick sugar such as candy. However, though, if your patient or resident is not alert or responsive at all, it's very dangerous to give them anything by the mouth. So it's very important that the resident who are diabetic eat at a routine type of time. And it's very important for the nurse to know when these residents are not eating as well, because it increased the risk of experiencing low blood sugar, which will create weakness. Question 9. Areas of the body where bones lie close to the skin is known as A, skin fold, B, a pressure ulcer, C, skin breakdown, or D, a pressure point. So between the bone and the skin, what is that known as? So the answer would be D, a pressure point. Why? It's because a pressure point is an area where the bone lies close to the skin. It's literally the definition of pressure point. So if the resident physicians apply pressure to that area for a prolonged time period, over 2 hours of the time period, the tissue on top of the bone can be harmed by the poor circulation caused by the pressure point. The pressure point varies depending on the type of resident position, what type of position they're in. But you as the CNA need to observe these bony areas close whenever a patient or resident position is changed, as the bony areas are at higher risk for skin breakdown. So if you ever go into the field, or when you get into the field, because you're going to pass, you guys are going to pass, okay? When you get into the field, this is why this test is going to be applied into the field. You're going to see some skin breakdown, and sometimes it's not because of your coworkers. Sometimes older people just break down, and the areas where they break down, especially on their hiney, say the crease of the buttocks, you might see skin breakdown, and that's just a pressure point, for example. So anywhere where the bone lies close to the skin, you can even feel certain pressure points on your body, is a pressure point. And last but not least, question 10. A resident is scheduled for a morning shower, but is refusing to take one. The best response by the nurse aide is to A. Explain that the shower is required to keep clean, healthy. B. Try to motivate the resident by collecting clothing and supplies. C. Ask if the resident has another preference for bathing today. D. Remind the resident you have the rights to refuse care. So, out of everything, what is the best response you as a CNA to give to your patient? And the answer would be C. Ask if the resident has another preference for bathing today. And the reason being is because your patient have the rights to make decisions regarding their care. One of those decisions may involve the timing of certain tasks. When your patient is refusing care, communicating with your patient in a respectful way, acknowledging them, their rights and preference can be very, very helpful. So, for example, like the question asks, in the morning, they may be difficult. It's very difficult if you are a morning shift as a CNA. Some elderly residents, due to increase of pain and stiffness in the joints, may not want a shower. They will refuse to participate in the activity. So you as the CNA, you should try approaching them later on during the time of the day where they're already up, ready, more mobile for a period of time, and then, decide later on to give the offer for them to take the shower. So you can ask for a different time. You can ask, okay, you don't want a shower? Cool. Would you like a bed bath? And most likely when you're working in the field, if you report that it's their shower day and they refuse, the nurse will tell you, offer them a bed bath, offer them a alternative. And if they completely refuse to take a shower, bed bath, any type of cleaning, they're going to tell you to clean their bed sheets so they can at least have fresh bed sheet. That's just a bonus tip. But it will be C for them to just get offered another preference of bathing for today. They have the rights. You can remind them, but it's not going to help. You're trying to motivate them to get the shower. So that is the best response you as a CNA. Congratulations, you guys completed the 10 questions to study. I just wanted to keep this one nice, short, simple, and sweet. If you haven't seen the previous study 1 and 2 study guide, make sure to watch more. And remember, what you are is what you've been, and what you will be is what you do now. Subscribe to the channel if you want to see more healthcare related videos, and make sure to give this video a thumbs up if it helps you with studying, using it as an extra resource. It does encourage me to make more.